we have variant, and we don't know the day we are going to see a variant emerging that doesn't that we will not respond to the vaccine we have. And this is also a reason why I warn the developed world. You refuse to give vaccine to people at risk. You are the agent of the continue of the spread of the pandemic. And the day we will have a variant that doesn't respond, it will roll back to you. So we will lose as the world. We will use the fight against the 3V, vaccine versus variant, and you will be responsible of that. So I also want to warn the world to stop politicizing COVID-19 because it has already caused unnecessary suffering and death across the world. And we need to move forward and understand that this is a rehearsal we will have at the pandemic. Thank you.
Thank you so much, Professor Pinaguajo. Like lots of interesting things there. In some ways, a more, I would say, hopeful story coming from your own country. I'm sure there will be a lot of questions that will come from your presentation. But I want to invite next Professor All. She will be talking about Asia. So.
Okay, great. You can hear me and you can see my slide, correct?
Yes.
Great. Hello, everyone. First of all, let me thank the Political Science Department and Dr. Dura Martinez for inviting me to be part of this timely and important discussion. And the COVID-19 pandemic not only exposes the varying degrees of effectiveness in countries' pandemic responses, but also highlights the vital importance of an effective national crisis management system, as Dr. Pinaguajo already mentioned from the experience of Africa. Well, no country is out of the woods, and we are witnessing the fourth wave throughout the world. Yet, as you can see in this figure that compares newly confirmed cases per million people by continents, Asian countries that have about 60% of world population have managed the pandemic relatively well compared to other parts of the world except Africa. And as a comparative political scientist, I want to unpack some of the generalizable lessons we can draw from their experiences. So I'll first provide an overview of the pandemic in Asia, explain 4 key pillars of effective crisis management system and implications. So there certainly exist lots of variations throughout Asia. It's a big place with lots of people, lots of countries. And as you can see in this figure, we have countries like the Philippines and Indonesia that still struggle with high number of cases, as well as globally successful players in relative terms, such as China, South Korea, Singapore, Vietnam, Taiwan, and Hong Kong. So these are some of the examples of successful players in the region. And there exist 2 commonly discussed explanations behind their relative effectiveness. First, those players have a strong state capacity vis-a-vis society, which is linked to their ability to enforce draconian lockdowns and social distancing measures, along with extensive tracing of their own people. Yet we see various regime differences like the authoritarian states of China and Vietnam, as well as democracies like Korea and Taiwan. And China and the Philippines, for example, China and the Philippines have draconian lockdowns, but a country like Korea never had a travel ban or a complete lockdown. So their approach has been quite different. And Malaysia and Indonesia has a federal system with more autonomy at the local government level, while Japan, Vietnam, Thailand, and China have a unitary system where the central government has more control over the society and local governments. So a lot of variations exist across the region. The second explanation is their common and shared experiences with new pandemic. So you see that a lot of these Asian countries suffer from SARS, avian flu, swine flu, and MERS in the case of South Korea in 2015. However, it is not really about experiencing the pandemic itself, but what really matters is what they learned from those experiences and what kind of efforts they put into rebuilding or improving their crisis management system. So there's more to these stories that cannot be captured by these two explanations. So let me discuss the generalizable foundations for effective crisis management system based on the following four criteria: clear leadership, public-private partnership, and clear crisis communication, and lastly, public collaboration. So first of all, clear leadership plays a critical role in signaling the urgency of the matter to all the actors in the country, which creates a shared goal among stakeholders so that they can generate all-out efforts for crisis management. It also streamlines command structures to mobilize resources without unnecessary interagency competition. We know it quite well from the US experience that a fragmented response system lacking a clear national policy often results in a flawed and uneven response. In case of Asia, several countries have a clear command structures. So in the case of China, although it took the government more time than needed to respond to the Wuhan situation, but once Beijing took charge, it effectively distributed resources across the country and took a very draconian measure of locking down the entire province of Hubei with 60 million people. In Vietnam, Taiwan, and Singapore and Hong Kong, and Korea, the central government also established a control tower that coordinate resources across government bodies. And along with a clear leadership, raising the national alert level according to the development of infectious disease is also very critical, because different level activates different bureaucratic responses, and it can also convey the urgency of the situation to the public. South Korea and the US both confirmed their first COVID cases on January 20th, on the same day. Seoul raised the alert level to orange, which is warning, with 4 confirmed cases, and to red with the first community outbreak. Singapore also moved pretty quickly in raising the alert level, but it never needed to raise all the way to red, because by the end of January, Singapore already had travel ban in place, especially anybody coming from China. On the other hand, Washington did not declare a national emergency until mid-March, and that was after 6 states had already declared a state of emergency, if you remember, 13 months ago, and in-person classes were suspended across the country right after spring break. Japan, actually, it's similar to the US case, although it is not a federal system, it's a unitary system. The local governments of Tokyo and Hokkaido announced the state of emergency earlier than the central government. So what this tells us is that there existed mixed threat perceptions over the virus between the center and the local governments, which come with a lot of confusion. Second pillar of the crisis management system is the partnership with private actors, such as medical communities and biotech companies, who can assist in developing the offensive tools in epidemic control. 2 globally praised and exported tools from South Korea are the product of public-private partnership. First is the drive-through and walk-through testing sites that you can commonly see in the US these days. They first started in Korea by a local hospital that became a global model. Second is the test kit that allowed effective 3T model, test, trace, and treat. And this test kit developed by Korea also was exported throughout the world. And to develop the test kit in a timely manner, the Korean CDC worked closely with biotech companies by sharing know-hows and giving emergency authorizations. This contrasts to the US situations. And instead of drafting the private sector early on to develop tests, which is different from vaccine story, but US health officials stuck to time-consuming vetting procedures and relied on test kits only prepared by the CDC until late February, only to discover that some of those test kits proved faulty and FDA decided not to approve the distribution. So if CDC and FDA had worked together in partnership with the private companies, well, we could have saved more time and lives by developing the test kits much faster. And here I want to emphasize that after China's SARS and Korea's devastating MERS experience, scholars and policymakers in East Asia reformed and modeled their crisis management systems after the American CDC and FEMA. So it is an irony that we are talking about those catching up countries in East Asia as more effective models than the US case. Here's another example of public-private partnership. So in Thailand, the faculty members from the Department of Public Health at Chiang Mai University developed a tracing app for epidemic control, which was widely used. On the other hand, if you look at the COVID-19 app of Japan, it was initially developed by volunteers at Microsoft Japan, and then the central government decided to take it over to nationalize it. But in the process, the government outsourced it to a private company who then subcontracted different services to multiple companies, as you can see here in this flowchart. The app was found to have a bug in September 2020, and it took more than 5 months for the government to solve the issue because several actors were involved and no one was willing to take the responsibility. So fragmented structures comes with a lot of confusion and delay and costing lives as well. Third pillar is clear crisis communication. Sharing credible information about the situations in a timely and transparent manner is key in developing public trust while increasing the government's authoritativeness within the society. So research suggests that people's risk perception of the severity of health threat definitely contributes to public compliance with the health guidelines. And if government does not provide adequate information, people will always seek alternative communication channels to resolve ambiguity and anxiety, which open rooms for misinformation and myth and rumors. So if you look at Singapore, the Prime Minister Lee Hsien Loong, always wearing bright shirts, and he came out to directly address to the people about the COVID-19 situations in Singapore, uploading the video to YouTube around 3 to 4 times a month, explaining the situations very clearly. In case of Korea, the director of CDC held a daily briefing for months with an approval rating of 90% since the day of first confirmed cases. And Wall Street Journal, as you can see on the right side, praises her for her leadership and clear communication style that earned public trust. And when you have public information campaign, it is also important to launch those campaigns on various platforms, including traditional media outlets, social media, text messages, post and placards to increase people's risk awareness. So this shows the case of Taiwan, where the Taiwanese CDC has answered individual concerns on Facebook and also at Line, which is a popular messaging app just like WhatsApp in the US, as well as circulating downloadable cartoon stickers of the health minister, as you can see here. In many other countries, you will get personal text messages about the confirmed patients or outbreak near you. And last one is the popular video made by the Vietnamese government on hand washing that went really viral. Of course, while such systems function as a heavy counterweight to rumors and misinformation, it definitely raises the concern over the rise of digital authoritarianism and then the debates between urgency of public health versus protection of privacy in a democratic context. In many Asian countries, public health officials and local governments have greater access to personal information because they use CCTV, cell phone records, credit card receipts, and other private data. China adopted a color code system that reflects each person's COVID-19 status, as you can see on the left side at the CNN. Anderson Cooper is discussing that and implications. The right side is the Vietnam's nCoV app, which lets its own citizens to report people that they suspect might have the virus. So if I report that, oh, I think my neighbor traveled, but is not really following the guidelines, then the local authorities will visit my neighbors and investigate. So how to strike a balance between civil liberties and public health concerns remains a critical issue, but a lot of polls in Asian countries suggest that the majority of citizens prioritize public health over privacy during an outbreak, which is quite different from Europe and North America, as we are seeing as we speak. Lastly, the effective handling of infectious diseases cannot take place without citizens' participation, especially because non-pharmaceutical interventions such as personal sanitization and social distancing are key to control the virus. But again, if the public is more educated about the urgency of the situations based on clear leadership, clear crisis communications, then they will trust the government more and they will be more likely to abide by public health guidelines. So these are some of the lessons that we can draw from Asian experience. So what are brief implications? Well, just to wrap up, the pandemic has really sparked intense discussions by creating conflict between values that should not stand against each other. First is the discussion on lives versus livelihood, as if there is no common ground. In terms of economic implications, those countries who managed the pandemic effectively early on had less disruptions in businesses and people's lives, and they found relative normalcy earlier. So the prospect for economic recovery in Asia has been better and brighter than Europe and North America. Second is, as Dr. Binagwaho already mentioned, is the tension between politics and science. And we have been seeing how the issue of pandemic has been politicized in almost every country, every places, making it really hard to contain the virus and to collaborate with other countries. And as a scholar who studies international relations, the third takeaway is that in IR theory, usually non-traditional security threat like climate change and infectious diseases and the pandemic is supposed to unite every nation and people around the globe. But we have witnessed very balkanized and inward-looking responses, starting from the origin of viruses to travel ban to vaccine diplomacy and distributions. So there's a lot to think about going forward because it is already very much politicized with a lot of diplomatic implications. So Asia is such a big place with so much diversity and complexity. So I think I just scratched the surface only, but I hope it was useful to you and I look forward to our discussions afterwards. Thank you.
Thank you so much, Professor. Oh, that was fantastic and a lot more to think about. I will also take a minute to thank the Dean of our College of Fine Arts, Humanities, and Social Sciences has joined our group, and we also have the three Associate Deans, Associate Dean Sukim, Associate Dean Richard Serna, and Associate Dean Well Kamal. So thank you to all of them for being here. So last but not least, Professor Agustina Giraldi will be talking about Latin America. So give me 1 second to make sure I can pin you to that. Okay. Thank you.
Oh, can you hear me?
Yes.
Yes, and can you see my screen?
Yes.
Yes, excellent. Well, thank you so much for the invitation to present my work. Thank you, Angelica, for thinking about me and the work of my colleagues. What I will be presenting to you today is research that we've been doing with a group of scholars on COVID-19 policies implemented at the subnational level. And I'm very glad that Seung Jong, I'm sure I'm pronouncing your name incorrectly, brought up the issue of federalism versus unitary countries, because we think and see and find that that makes a huge difference in terms of how governments have tackled the pandemic. So first of all, just for you to get a sense of how things are in Latin America, these are the cumulative confirmed number of COVID cases. Of course, Brazil here is an outlier, but we do see that on the worst performers, we have Brazil, of course, Argentina, Mexico, and Colombia, the big countries of Latin America. What we do in our paper is, as I said before, we have a particular interest in addressing the subnational responses, is to zoom in the federal countries of Latin America. And we have 4 federal countries in Latin America: Brazil, Argentina, Mexico, and Venezuela, which is federal on paper, not so much in practice. And so what we wanted to do is to study the response of how these federal governments have implemented policy responses to tackle COVID. What is exactly what we mean by policy responses? You might have heard about the index of stringency compiled by the University of Oxford that measures a bundle of policies that different governments have implemented to tackle the pandemic. And those policies range from school closures to workplace closures to travel bans, etc. I will zoom in on that index later on. And what we can see in this very messy graph is that as numbers go up, we see more stringent policies being implemented across countries. But yet we see, of course, the higher levels, the higher stringency is at the beginning of the pandemic. But we see that some countries continue to keep that level, whereas our others go deep down as the pandemic progresses. So this is the picture at the national level, right? A lot of the variation in terms of cases, and also a lot of variation in terms of how national governments have tackled the pandemic. So in our analysis, in part because we lack data for the case of Argentina, we decided to also make the comparison with the United States. So what we are looking at is the 4 federal countries of, 3 federal countries of the Americas. And we did not include Canada, which would be another interesting case of the Americas, because we also wanted to study the politics behind the implementation of these policies. In these 3 countries, during the first year of the pandemic, and that is the scope condition of our study, we're only looking at the first year of the pandemic, we're dealing with 3 federal countries, the United States, Brazil, and Mexico, that are ruled by populist leaders. We have 2 populist leaders from the right, Donald Trump and Jair Bolsonaro, and then a 3rd populist leader from the left, Andrés Manuel López Obrador, all of whom downplayed the importance of the pandemic. And thus the importance to see at what happened at the subnational level, and Sung-Yong talked a little bit about that mismatch and coordination problems that exist. So this is the team of scholars with whom I'm working. Angelica knows the majority of them because they are fellow professors and PhD friends from Brown University. Eva Rios from Brown University, Eduardo Moncada, a former Brown PhD who now teaches at Barnard College at Columbia, Rich Snyder, Brown University professor, Paul Testa, another Brown University professor, and Cyril Bonuna, who is a PhD candidate at Brown University. By the way, I have to say that this is the first time that I'm working with so many people at the same time, which has been fantastic, but also it has its own challenges. And by the way, for those of you who are political scientists, comparativists in particular, this is the first time that all of us are working with an Americanist. So Paul Testa is an Americanist, and thus we have been able to bring to the comparison of Latin American cases the case of the US, which is very rare in comparative politics. Typically, we do not compare Latin American countries with the US, but we were very interested in that comparison of the three populist presidents. So essentially, our question is, what explains variation in policy responses in federal countries? So why is it that states responded so different to the pandemic? And as a preview, we find evidence that subnational policy responses are not primarily driven by epidemiological, demographic, or socioeconomic factors. Instead, what we find is that those differences are driven fundamentally by political factors, in particular the strength and internal organization of political parties, the popularity of the presidents, and also the coalitions of governors that can form or not. So what data do we use? As I said before, there is this Oxford Policy Stringency Index that measures policies at the national level. But now we have data from the University of Miami, and for the case of the US, University of Washington, who also, the scholars in those universities have produced scores for the subnational level. So essentially, they looked at all these policies that I have listed here, as I said before, from school closures to suspension in public transit, public information campaigns, face mask requirements, etc., and they come up with an index. That data is publicly available to anyone, and I would encourage you to take a look at it because the work that these people have done is quite unbelievable. They have tracked every single of these policies for every single day in each of the subnational units in all of these countries. So that is a gem in terms of data that we have there to do research. And so here is what we find, right? So on this column here, we have the policy stringency index. As the numbers go up, the more stringent the policy. Here we have the average policy stringency index. I mean, these are comparable, but here we have the average. And here we have the number of COVID-19 cases per state, right? So the darker the state, the more COVID cases you have. And the same thing here, the darker the state, the more stringent the policy is. So the first thing that we wanted to get a sense of is that, of course, the distribution of COVID cases is very different when we look at the subnational level. This is not new. We know that more urban areas tend to have more cases than rural ones. But yet, when we overlap this map with this map here, we see that in cases where we have higher, not higher number of cases, we have very stringent policies. Or the opposite, cases in which states in where there are lots of cases, yet those policies are not stringent at all, right? So there is not a connection between having more COVID cases and having more stringent policies. Another interesting conclusion that we can draw from these maps here and tables, I love maps. I think that they can tell us so much just by displaying data, is that there are important differences across countries as well, right? So across federal countries. We do not only see differences within countries, but as we know, policy stringency has also varied across countries. With the US declining, this is the average, by the way, what we see in this line is the average for each country. And what we see here behind in gray are the different averages for the different states, right? But so in the US, we see a systematic trend downwards in terms of less stringency over time. And again, this is the first year of the pandemic. So how do we explain variation in policy responses? And here's when we actually come with our political story. And here I'm also addressing from a different perspective, perhaps, some of the claims that my two colleagues made earlier. There is a lot of politics going on in the pandemic. In this case, we're not talking about the politicization of the pandemic, but rather about the political variables that help us account for this case, the variation in policy responses at the subnational level. And the issue of coordination is key here to understand, right, whether there is or no variation. We argue that there are different ways in which governors and presidents can coordinate policies, and we identify what we call horizontal coordination, meaning that governors at the state level will be able to coordinate among themselves to implement policies. And two fundamental ways, or one fundamental way in which governors can coordinate is through party organizations, right? If governors belong to the same party, one would expect to see lower variation in levels of policy stringency across states that are next to each other or also that pertain to the same political party. But we can also think of having vertical coordination, right? And here is when a president can inflict or can order governors to act in a given way, right? And here the party is also very important. We can see partisan coordination by national party elites, the national elites telling governors what to do. But also the president might use partisan or agenda setting or even his own presidential popularity to force governors to implement policies. And so when we have vertical coordination, we would expect to have lower variation in levels of policy stringency across co-partisan states. And finally, we can also think about a world where there is no coordination whatsoever, right? So these are our hypotheses. We're not saying that this happens at the same time in any country, right? So here we are at the theoretical level, but we can think about a world where there is no coordination at all. And what would determine the policies that are implemented are perhaps internal factors of each individual state, like COVID rates, population at risk, or state capacity. If we are in that scenario, we would expect a lot of variation in levels of policy stringency across states. So how do we move from this theoretical part to our cases? So how do our federations, our three federations, fit into this framework? And I'll show you results in a minute, and this table summarizes the results. So basically what we find is that in Brazil, there was no coordination at all. That is the scenario of that last row that I told you about. In Brazil, Brazil is a country that is characterized by having over 40 political parties, and so it's very hard to coordinate across levels or within levels